Welcome. Ever experienced swelling and discomfort around your upper eyelid? It could be dacryoadenitis, an inflammation of the lacrimal gland. In this video, we'll explore this condition, its causes, symptoms, diagnosis, treatment, and more. Join us as we delve into the world of dacryoadenitis. So, what causes dacryoadenitis? The culprits can be broadly categorized as infectious and non-infectious. Infectious causes are frequently viral, with mumps and Epstein-Barr virus being common offenders, especially in acute cases. Bacterial infections such as Staphylococcus or Streptococcus can also trigger it. Less common but important to consider are fungal infections. Non-infectious causes include inflammatory conditions like sarcoidosis, Sjogren's syndrome, thyroid eye disease, and orbital inflammatory syndrome. Trauma to the area can also lead to inflammation and dacryoadenitis. To understand dacryoadenitis, we need to understand the lacrimal gland's role. This gland, located above the outer part of your eye, produces tears. In dacryoadenitis, inflammation disrupts the normal tear production process. This inflammation can be caused by infection directly affecting the gland cells or indirectly by inflammation triggered by systemic diseases, which secondarily affect the gland. Swelling occurs as the gland becomes congested with inflammatory cells and fluid. This congestion can affect not only tear production, but also cause pain and pressure around the eye. Dacryoadenitis isn't extremely common, but it's important to be aware of. The acute form is more prevalent in children and young adults, often linked to viral infections. Chronic dacryoadenitis, on the other hand, is more frequently seen in adults, especially those with underlying systemic inflammatory diseases like sarcoidosis or Sjogren's syndrome. While prevalence data is limited, understanding these demographic trends helps in diagnosis. How does dacryoadenitis present itself? The most noticeable sign is swelling and redness in the outer upper eyelid. You might also experience pain or tenderness in that area. Excessive tearing or, conversely, dry eye can occur. Some individuals may notice a palpable mass or lump in the upper outer orbit. Double vision or diplopia and proptosis, where the eye protrudes forward, are less common but possible symptoms. In severe cases, limited eye movement can occur. Diagnosing dacryoadenitis involves a comprehensive approach. A thorough medical history is crucial, including any history of systemic diseases or recent infections. A detailed eye exam will be performed to assess the swelling, tear production, and eye movement. Imaging studies, such as a CT scan or MRI, may be ordered to visualize the lacrimal gland and rule out other orbital pathologies. In some cases, a biopsy of the lacrimal gland might be necessary to confirm the diagnosis and identify the underlying cause. Dacryoadenitis can be broadly classified into two main types: acute and chronic. Acute dacryoadenitis usually presents suddenly with intense symptoms, often triggered by a viral or bacterial infection. Chronic dacryoadenitis develops gradually over weeks or months and is commonly associated with underlying inflammatory conditions. Treatment for dacryoadenitis depends entirely on the underlying cause. For acute cases caused by viral infections, treatment is often supportive, involving rest, warm compresses, and over-the-counter pain relievers. Bacterial infections require antibiotics. In cases of chronic dacryoadenitis related to systemic inflammatory diseases, treatment focuses on managing the underlying condition with medications like corticosteroids or immunosuppressants. If a mass is causing significant pressure, surgical drainage might be considered. Preventing dacryoadenitis can be challenging, especially when it's linked to systemic conditions. However, practicing good hygiene, like frequent hand washing, can reduce the risk of infectious causes. Managing underlying inflammatory diseases effectively is crucial for preventing chronic dacryoadenitis. Regular eye exams can help detect early signs of inflammation and allow for prompt intervention. The prognosis for dacryoadenitis is generally good, especially with prompt diagnosis and appropriate treatment. Most cases resolve completely without long-term complications. However, chronic dacryoadenitis associated with systemic diseases may require ongoing management to prevent recurrence. Recent research is focusing on developing more targeted therapies for inflammatory eye diseases, which may lead to improved treatment options for chronic dacryoadenitis in the future. Innovations in imaging techniques are also helping with earlier and more accurate diagnosis. Ongoing clinical trials are exploring the efficacy of novel immunomodulatory agents in managing inflammatory orbital conditions, including dacryoadenitis. Stay tuned for more updates as the field evolves.